and errors. And this is no fault of an algorithm, this is just what it does. It's taking existing data, existing patterns, and just using them. The danger of that, though, is that it may hard code discriminatory decisions into our decision-making process. So if we're using algorithms in the court system, if we're using algorithms for health insurance, what it's doing is it's taking historic biases and it's now hard coding them or hardwiring them into the decision-making. And the biggest risk is really that those decisions are becoming less apparent. When you're in a court system or when you're dealing with another human, you can challenge the decision. It's also obvious that a decision has been made about you. But as we switch more and more to algorithmic decision making, it's not clear how transparent those decisions are. In fact, it's not clear that decisions have been made about us at all. But behind the scenes today, either by algorithms made on historic data patterns. Now the question is, why does that matter? Who cares? Well, to a statistician, or at least official statisticians, we have an informal constitution which are known as the UN Fundamental Principles of Official Statistics. And Principle 1 says that official statistics are an indispensable element in the information system of a democratic society. So there's two very important elements here. We're an element, so again it's back to this idea that we're informing but we're not the full value chain, and we're intrinsic to democracy, to this idea that government policymakers are making decisions. So we're serving government, but we're also serving the public. And again, this is back to the idea of transparency and back to the idea that data are a public good, which I'll come back to in my closing remarks. So basically, we're emphasizing a lot. We see the citizens' entitlement to public information. And as I said, I'll return to that in a moment. Where I work now with the OECD, our recommendations on Council for Good Statistical Practice, we essentially say something very similar. We say that statistics are an indispensable tool for good quality analysis, transparency, and the functioning of democracies. And this is really the point I'm coming to, that as we switch from evidence-informed to algorithmic decision-making, we may have a challenge to our democratic systems. And in fact, if any of you have read the book recently by Kissinger and others on the impact of AI, one of the questions they ask now is, can artificial intelligence coexist with democracy? And they're coming at it from a different angle to us, but not too dissimilar. And this is one of the things that I don't think that we're thinking enough about as things are changing. So a key message in this talk really is, before we get into the health space, is official statistics are produced to inform decisions, not to make them. And this is a critical difference. We're there to produce or to support democracy, but not to replace it. And this is really the bit I want you to think about, because this is what's happening behind the scenes, or potentially happening behind the scenes with the modern tech information systems. So what are the implications for health then? Well, healthcare systems rely critically on data. I mean, the healthcare sector, just like any other sector now, is digitizing. All of the systems that you're using are reliant on data. So one of the issues here is who's governing this data, who's managing the data. And what we see is the paucity of data governance internationally. We're seeing a very, very fragmented system globally. There's different governance systems either being introduced or not introduced at all. So in the literature, you'll often hear about the three-dragon model, which is in the US where they prioritize private industry, in Europe where we prioritize the individual, and in Asia where they prioritize the state. And it's not clear how those three ideologies can coexist. And again, this really matters because now we're starting to exchange data all of the time. we're exchanging data deliberately, but we're also exchanging data almost by accident, because as data centers are built and geolocated around the world, they're now optimizing management flow systems, which really have nothing to do about where the data belongs. It's moving data to minimize the burden on the exchange. So our data are moving across data centers all of the time, and it's really not being managed particularly well. One of the other things I think is important to think about is when we talk about this data-driven, it sounds very scientific, it sounds very modern, it's very cool. One of the things I think it may be implicitly doing is over-promising. I think we're trying to remove or trying to impose a sense of certainty that doesn't exist. As statisticians, at least, I think we should always embrace uncertainty. It's always there. It's actually increasing because of the different types of data that we're using. And attached to this, this notion of algorithmic use is the notion that correlation is enough. So the end of science in a way. So I think implicitly what's going on in the data world is actually discrediting the scientific process, and that's really, really risky, because it's challenging the whole idea of what knowledge actually means. So now, instead of stating your hypothesis before the test and then testing it, we're then testing the hypothesis on the data that helped us to construct the hypothesis in the first place. And that's a breach of fundamental science. But this is what we're doing. And this is really, really risky. From an artificial intelligence point of view, I mean, what we see is enormous potential in the health sector and every other sector. But I think we must retain human oversight. So we must move, I think, from AI to IA, which is basically intelligence augmentation. But we need to be careful all the time about the data quality that's being used in our AI systems. We need to make sure that data sets are being updated, because a lot of the models have been trained on historic data and that those training sets haven't been updated. We also need to make sure, and this is back to the point I made at the start about the public good, that our models have access to data, because what we're also seeing internationally is, despite the increasing volume of data being produced, the amount of data that are actually publicly accessible is actually reducing. A lot of data are disappearing behind paywalls or just disappearing completely. Stephen Bellhurst in the New York University a couple of years ago he asked this question, are we heading to a data winter? At the time when he posed the question, he was really concerned about technology companies withdrawing data because they're now understanding the value of the asset that they hold. But in recent years, unfortunately, what we're now seeing state actors starting to withdraw public data and actually dismantle public data in some countries. And our fear is that there may be a risk of contagion attached to this. If those data disappear, then AI faces, it's not just a crisis of democracy, but it's a crisis for artificial intelligence itself, because those data will no longer be available to train models. And finally on AI, this morning I was over at the Office of National Statistics, just a couple of miles away, and we were discussing the use of artificial intelligence in official statistics. And the question that a lot of official statistics offices are facing, and I think a lot of the health sector should be thinking about this too, is what does it do for trust? What does it do for trust now, and what will it do in the future? If we produce a statistic that uses artificial intelligence, probably nobody cares until that statistic is challenged. And then what's not clear is, in the court of public opinion, what happens then? So for example, we were talking about price indices this morning. If you can say to the public that your price indices were compiled by people who actually physically go into shops, they see the prices that are faced by you as a consumer, that's probably very reassuring to a lot of people. It's not that that statistic is any better than information that more reassuring. But the question is, in 10 years' time, will that still be the case? Because maybe people who've come up in the digital age and are digitally native, in a few years' time, they may be saying, well, why did you go to the shop? Why didn't you use artificial intelligence? It's so inefficient what you're doing. So I think we're in this transition from kind of the analog world to the digital world, and as people who are producing statistics, we need to be careful about that we don't run too far ahead of our public. We need to modernize, we need to transition, but we need to do it in a way that we don't leave our public behind. Because if we move too fast, we may actually break the social contract that actually makes our data useful. But eventually, if we're too slow, if we don't move in time, the digitally native people are going to get frustrated with us because they think that we're just Luddites. So it's a delicate transition that we're going through. So this probably was very irrelevant to what you've been talking about for most of the day, but I hope it gives you some food for thought. And just to let you know, this is what some of the statisticians around the world are thinking about. So with that, I will finish, and just a little plug, if you want any information from the OECD, we have a lot of health statistics, but we have a lot of economic and productivity statistics. You can find it all on these various platforms. Thanks very much.
Thank you so much, Steve. And as we have now certain time for Q&A until the next session starts at 2, any questions from the audience here? Iñaki Gutierrez from Euskadi.
Yeah, well, we met yesterday.
I was hoping you'd stay quiet.
I'm Iñaki Gutierrez Ibarluce. I'm the Director of Health Innovation and Research of the Ministry for Health in the Basque region in northwest of Spain. My question, it is very food for thoughts. I think it is interesting. One of the things that you were stressing, it is the fact on artificial intelligence and intelligent augmentation. My question it is how we can bring this to the general audience and to the public, and how we can translate that things that are. I think this morning also some of the speakers were stressing that if we are analyzing trust, it's difficult to have something that is attainable to make any kind of decision. But it's how we can share that, because it seems to be that there is, even among decision makers, that artificial intelligence is the key factor by which we are going to solve the problems of the world. And in reality, most of the data that we are using, it is mostly trust. So it is how we are in need to build that in terms of creating trust and also sharing this with the general population and from the perspective of the OECD.
So, well, my personal view is back to this word certainty and uncertainty. There's a lot of hype at the moment around artificial intelligence, as there is with any new wave. I think a lot of us are guilty of overselling, overpromising. I think we should be a lot more circumspect. For me, the issue really is about quality. If we're certain that we can produce something of good quality, then fine. If we're not certain, then we just need to make it clear to policymakers that that's just not the case, and we have to stand firm. What was interesting, again, back to my visit at the ONS this morning, it's actually one of the first times I've seen a statistics office produce metrics where they've been using artificial intelligence, which they're satisfied is doing the job they asked it to do, and they were actually able to quantify the resource savings that it was generating, because I've seen so little evidence. I've seen a lot of hyperbole. So I think there is promise, but I think we have to start small, start where we're absolutely certain the tool is working. We've done a lot of testing at OECD on different types of AI, so we see a lot of promise in machine learning, a lot of promise in LLMs. We're using them quite a bit. On ChatGPT and GPT models, frankly, we're terrified. They basically produce garbage from a statistics point of view. They are not capable of ingesting data because of the distributional model that they use. The really scary thing is they produce very plausible looking numbers that somebody who's reasonably intelligent but isn't expert and doesn't have the time to go and validate, they'll get a number that looks quite realistic, but it's not. And worse still, the model will probably attribute that data to OECD or to the IMF, and it's not our data. So from a reputational point of view, this is something that makes us decidedly nervous. We have a project at the moment, we're working with the platforms to try and make sure that they use our data, they prioritize the official statistics. One of the lessons we've learned from that is in fact that our metadata weren't working. So we put a lot of effort in the last couple of years to making our data open. But what we hadn't understood is the metadata that we had constructed don't work for a machine-to-machine ingestion. So we're having to rebuild the entire metadata series behind our tables so that the big platforms can actually ingest our data automatically. So that's been a big shock to us. It also means for our statistical quality assurance frameworks, we're having to redo them to put in a chapter explicitly on metadata, both the traditional types of metadata, but now also the metadata that's required by large language models, which is different. So what I would say is hold firm. Don't oversell, don't overpromise, and don't give in on the idea that the world is certain. Policymakers love certainty. The public loves certainty. I mean, we saw it during COVID. People wanted answers. And I guess this is maybe the other issue that we need to be aware of. I think there's a kind of a cyclical path which is between what we might call normal and crisis. During a crisis, people's tolerance basically reduces. They don't care about data governance, they don't care about privacy, they don't care about anything that solved the problem. As soon as the crisis passes, then kind of the normal standards resume. So we have to understand as well when we're talking to people, where are we on the kind of crisis cycle? Because what we say in normal times may not be satisfactory during a crisis and vice versa.
So much. We have still a few minutes before Steve. Oh, lots of questions, and I still have my own question. So, beg your pardon if we could start the session after a little bit late, but we'll compensate.
Thank you. I've got quite a simple question. Hi, I'm Louisa. I used to work at ONS, but now I'm at Public Health Wales. My question is, I wondered if there was anything you were able to share with us that could help us do something similar.
Sorry, I didn't catch the actual question.
Maybe I'll just speak louder. I was really interested in your comment about the metadata and having to change the metadata to work for the AI platforms scraping that. I wondered if you had anything that you could share with us on that so that we could look at the same issue.
Yeah, we're actually working on this at the moment. So in fact, when I leave tomorrow, I'm going to Rome to the SDMX conference. So SDMX is the data exchange model that statisticians use. It's not dissimilar to DDI. It's slightly different, but not dissimilar now to what Google are using for data commons. But SDMX is the exchange model that we use. And in fact, in SDMX, the whole point of that was to get the metadata right. So we've constructed new standards, so we can. They're readily available. But and if you want to contact us, we can give you the exchange metadata that we're using.
Thank you, Steve. Wondered if, as part of your ONS work, you've got any reflections on what we're going to do about the poisoning of data sources by AI, and in the health context at a much more micro level. We're not only seeing the AI perpetuating error, but over time introducing new error when the AI trains on data that AI has already touched. So how would we consider identification of poison data sources, how we filter those out, how we work around them?
Yeah, so what we're talking about here is the snail or the snake eating its own tail. And this will accelerate if the data governance don't set in and protect some of the data that really need to be public. The generation of synthetic data, in theory, is a good thing, but in fact, because it's built on the historic data, it's just further perpetuating the patterns that existed in the past, and it's not incorporating the new trends. I don't think there's anything we can do additional. I mean, I think it's the same risk, only worse. It's just accelerated. It's just exacerbated. So at the international level, we're really fighting, perhaps a lost cause, but we are really trying to fight for an international data governance agreement to try and identify. So there's two things we're trying to do. One is identify data sets that should be protected as a public good. This might be some health data, but in particular, a classic example would be meteorological information. You may have seen in the US, a lot of the NOAA data sets have disappeared. That's fatal, not just for the US. I mean, in time, that's going to be a disaster for them, but it's going to be a disaster for everybody else, because the global meteorological system feeds off everybody's model. I mean, Europe needs data from the US, Asia needs data from us. So as those data disappear, it causes a crisis everywhere. So there's some data need to be protected as global public data sets. But there's other data clearly have a commercial value to the owner, to the company. We have to respect that, but we have to make sure that we can still retain access. Another issue that's of concern to us is, as governments start to privatize activities that used to be a public service, whether it's health, whether it's transport, whether it's education, they're not taking data seriously. So when they sign the contracts, they're signing over everything and they're not retaining ownership or access of the data. So a lot of the administrative data that national statistical offices have access to is slowly disappearing, because it's disappearing behind a firewall, because the governments in countries didn't understand what they were signing away, and then they're having to purchase back their own data from the private sector. So these are really kind of mistakes that are happening, because I think a lot of governments have moved into the digital era but still think of infrastructure as tangible, and they haven't understood the modern digital infrastructure that's required to run a digital economy. And I think they're really struggling, and it's our job to try and help them, but it's not easy.
Okay, so I think Tiago, Taveira, Gomes had to leave earlier, so I'm going to do the introduction of this the first panel in the afternoon, a fireside conversation. We have pleased to have here Anna Bartlett from the Welsh Government, a perspective from the Welsh Government Social Welfare. So round of applause to Anna and the seat. It's David Teague from ICO Wales, and Dave Parsons, who are going to be also speaking in a lightning talk afterwards, but they are going to help themselves in this fireside conversation as introduced. The floor is all yours.
Oh, I'm not going to sing and dance now. Afternoon, everybody. My name is Dave Parsons. I'm the manager within Digital Health and Care Wales for the Wales Accord on the sharing of personal information. It's something I've been part of for, it'll be 20 years in November, believe it or not. I think somebody else said this morning, I haven't worked here for 20 years, I don't look that old. But yeah, I've been involved in information governance and assurance for 23 years now, 20 years in local government. 3.5 years now in Digital Health and Care Wales, leading the WASPI team. I'll hand over to my colleagues before I talk any further.
Thanks, Dave. I'm Anna Bartlett. I work in the Welsh Government in part of the Digital Data and Technology Directorate. My role is to lead on data ethics and data sharing, so I have close links with Dave here. I have responsibility for certain bits of Mission 6 of the Digital Strategy for Wales, which is around data and collaboration, particularly around making sure that data is available and is reused ethically, safely and securely for the benefit of citizens in Wales. I've been doing this for about 8 years now. I kind of fell into it. I'm quite happy to explain how I ended up here at some point. But kind of key things that I've done over the last few years was the introduction of the Data Sharing Powers and the Digital Economy Act to Wales. Also leading on the data governance around the data sharing elements inherent in the clinically extremely vulnerable population during the COVID pandemic, and also our Nation of Sanctuary response to the war in Ukraine. And I will hand over to David.
I've got my own microphone. I feel like a bit of a loner because I'm the bad guy here as the person that does the regulating of all this work. So my name's Dave Teague. I'm the Head of Welsh Affairs for the Information Commissioner's Office. For those of you who don't know, the Information Commissioner is the UK regulator for data protection and information rights. It's not just data protection. How many people here have heard of data protection, by the way, and or know a little bit? Oh, God, that's excellent. When I started doing this job, 0 hands would go up there because nobody pretended to know about it. And I'm delighted to be here today. Ivan's fire has gone out, unfortunately, so it's going to be a slightly different sense of a fireside chat for us, I think. But we do work really closely together, all these institutions here, to make sure that things are in place in Wales to facilitate good data practices. We were looking at the headlines for this about this being around trust and ethics and compliance. How do we engender trust in that? So I thought I would start because data protection laws in the UK, you'll have your own laws all around the world, almost certainly. Again, that wasn't something that was in place 20 years ago, but mainly they are now. And I was really interested in Steve's Three Dragons approach there because I think the laws actually reflect that approach quite nicely. And from my perspective, if you comply with data protection law, you will automatically engender trust, and you will automatically consider the ethics of what you're doing with data. And the reason is that there's quite a few things built into the Data Protection Act 2018, and now the Data Usage and Access Act, and also the UK GDPR. So we've only got 3 to choose from, but they all cover everything nicely. And what we're looking at there is that some of the cornerstones of that. One is transparency. So data protection law is all about the rights of us as individuals. Every one of us here today has a lot of rights under data protection laws. One of those is the right to be informed. And we've heard the word transparent spoken quite a lot today. The other quote I picked up from this morning was something that Helen Thomas said, was that if you put people at the heart of what you do, like DHCW say they do, then you will automatically be doing the right thing. And that's very much the case for data protection. Because if you're transparent, you've got to tell people what you're going to do with their data, and that allows them to then make informed decisions about that data as well. You've also got to tell them why you're doing it, and your lawful basis, to get a bit technical under the law as well. So there's lots of reasons under transparency that will help engender trust. And if you get that right and you're open and upfront, quite often people will follow. I was having a really interesting conversation with somebody in genomics recently who said that if for people with rare diseases are much more likely to give full consent for their data to be part of studies and part of research, as opposed to people with fairly common conditions, perhaps, or lower, less serious conditions. And I think that can be reflected in the transparency of the information you give out. And the other issue then is around the ethics. There's a fairness principle. The very first principle of data protection says it should be lawful, transparent, and fair. And fairness is where ethics come into it for us, because you should be doing, before you process data in certain new ways and exciting new ways, you should be doing something called a data protection impact assessment, which allows you to see what the likely impacts are. One of the first starting questions is, why are we doing this and what do we want to achieve? Quite often answering that will go into the subject of the ethics of doing that. And on the subject of ethics, I will hand over to Anna.
Thank you. So my role is twofold. So I'm going to talk about data ethics rather than data sharing. I'll leave data sharing to Dave. So we can see data ethics in Welsh Government as being compliance with the law and compliance with the GDPR principles of fairness, accountability, and transparency, but it is also wider than that. So GDPR only covers identifiable data. Data ethics asks you to think holistically about all of your data use. So are you using aggregated data? Are you using statistics? Are you using them to make decisions? Is that an ethical way? Are you using it ethically? And one of the things that we try and get people to think about is it may well be lawful. Doesn't necessarily mean it's ethical, doesn't necessarily mean it's fair in a holistic way. And the other thing we ask people to think about is that data itself isn't neutral. You know, we talk about data as a thing. It's not neutral. How it's gathered, what it was gathered for, who gathered it, can introduce bias that we may not recognise some way down the line, particularly if we start reusing data that was gathered for one purpose for another. Is that the right thing to do? Does it tell us everything that we need to know? Are we introducing bias by the fact that we're using this particular data set over here and it was gathered for a purpose and we're trying to reuse it? So it's really important to think kind of very broadly about all forms of data use, be that personal identifiable and compliance with UK GDPR and the Data Protection Act and we're calling it the DUA Act now just for ease. Helps you comply with that element of it, but it doesn't help you think about the wider uses of data and the wider types of data that governments and public authorities may well be using. There are lots and lots of tools out there to help you assess the ethics of what you do. People in statistician type roles, people who do social research, so they're well used to conducting ethics assessments, but maybe operational teams are less used to doing that, but they are taking decisions that are driven by data. And I take Steve's kind of point on what does data-driven mean, and by this I mean they are taking decisions informed by analysis of data rather than an algorithm making a decision for them. Where this starts for us is that you need to think about it early, and I think David would agree that the data protection impact assessment and your data ethics assessment is one of the first things you do, if not the first thing you should do, rather than we're going to decide to do something and then start thinking about the data and the governance a little bit later. I'm going to hand over to Dave so he can talk a little bit about data sharing and governance.
So we're often known as the Mythbusters, the three of us. I think we should come up with some kind of Ghostbusters sign behind this. But just a show of hands, because I'm interested, I ask this question every time I go to a conference. How many of you have come across a scenario where somebody has said, can't do that because of data protection? It's a constant. It's something for the last 20 odd years has occurred. I mean, when David and myself started in this industry, and we were both working in local government 20 years ago, we would ask that question in every single training session, and David will know that because he came to some of mine at the time. But it's a really important question to ask. So one other question I've got, we've mentioned about ethical assessments, data protection impact assessments, the term DPIA. How many of you have come across that term, the DPIA that you need to complete? I'm going to take a bit of responsibility for this because I was one of the very first practitioners in the IG world to actually come up with a data protection impact assessment based from the ICO guidance back some 10 years ago or so, and it seemed to have just taken off. But it's the vital component to anything, because everything we want to do is for the benefit of individuals, it's for the benefit of our patients, it's for the benefits of our service users. But what you've got to do is sometimes just strip it back and go, what is it we're trying to achieve? How do we achieve it? There's been a common theme for me today, and it's interesting because I'm not going to give away my little lightning talk that I've got a bit later. But we talk often in Wales about some of the frameworks that we lead, and we talk around the terms culture and collaboration, and that's been mentioned throughout today. And a lot of it really is down to culture and collaboration and how we also improve another C, which I won't give away yet. I like to do a little bit of audience participation, so at this point I'm going to ask you all to do something. I want you to go to the person next to you and share your date of birth, or if you don't want to share your date of birth, just a memorable date that means something to you. Just for the next 60 seconds. Well, we're all comfortable talking, so that's a good thing, right? Have we all shared it? Has everybody now shared a date? Yeah, yeah. Several dates in some cases, yeah. Right, this is going to get a little bit more tricky now. Then, can you all get your mobile phones out if you haven't already? Could you pass it to the person that you just shared your memorable date with? I wonder how many of you actually use that one of those that code to get into your phone. I bet some of you do.
But it's tricky because we are people that are pretty concerned about this.
There is a reason. There's a reason why I've just done that. Sometimes we will ask people to actually open up their mobile phone and actually share the mobile phone with the person next to them. I mean, the purpose behind that for me is it's about confidence, isn't it? I mean, how did you feel? Anybody want to put their hand up to talk and tell me and give me feedback? How did you actually feel doing that? Were you nervous? Apprehensive? No? No? Pretty comfortable. That's a good sign. That's how the world is starting to move in the right direction in one respect. But think of it from a practitioner perspective. If they've suddenly got a request from, I don't know, say, a safeguard officer, from the police, or even just from somebody internally in an organisation saying, can I have this information? Can you share this information with somebody? How would you think they feel? And often than not, what we always come across are people that will go, well, that's a bit too difficult to deal with, that's a bit too hard, I'm going to put that in a box that's too hard and just go, I can't do it, I'm not going to do it.
But it was the same question with priests in the past.
Yes. But the point is, what we've got to do, and this is the other C for me, confidence. It's for us, it's our responsibilities to instill confidence in the staff that we work with, in the organisations in which we work with, and with our partners. Because if we instill confidence, actually the law and the things that we talk about are there to actually help guide us and to support us doing things. I always leave the message when we talk around data sharing and data protection, that is, the law is actually there to help us do things in the right way. We're not barriers. Which is great, but usually when I do, I always tell them it's your role, it's our role to actually find solutions and make things happen in a way that can actually comply with the law. So it is just a take. It is a confidence thing, but culture and collaboration is what you need in order for things to be really successful in the world of data sharing, really. And with that,
And I can definitely vouch for that, having liaised with several hundred organisations, particularly when GDPR was coming in years ago. Those that have got a good culture, a good secure culture, we talked about risk appetite earlier as well, if that's all got good rationale behind it, then that equips staff who are maybe sometimes at the coalface, at the front line of delivering services, to be able to give those messages of trust and confidence to people, and then people are much more likely to have that trust in the project or the processing that's taking place as a result.
Yeah, I'd agree with that. And I think the thing we've found in Welsh Government is that data protection, data ethics is sometimes seen as a barrier. They're not. They are an enabler. And I hope you kind of got the sense that we feel that from this, and that it enables us to make good decisions about what we do with data that don't then lead us to really difficult consequences somewhere down the line. So you comply with GDPR, and obviously there's clear risks to getting that wrong in terms of fines and reputational damage, but that's less clear when it comes to non-personal data. Doing data ethics assessments properly and thinking things in the round. So in Wales, we ask public authorities to think about the Equality Act and our obligations under that, about our obligations under the Wellbeing of Future Generations Act, and all of the wider pieces that we ask people to think about, help people make properly informed decisions about whether this is a good use of data or not, that doesn't then in 5 years' time go, oh, damn it, we've done something wrong because we didn't think about it here, which is why I've always said, do it right at the beginning. Because one of the things about doing ethics well is that it builds trust by making it clear to people that if you identify a problem early on, you can change what you're doing or stop doing it entirely. And I think the thing that is really important for me as a kind of data ethics professional is that if you identify issues that you cannot mitigate, you should stop. That doesn't mean you don't do it. It means you need to rethink and reorientate. But being willing to do that builds trust with the public. Doing that transparently and openly is a really good thing and helps us make good decisions as government, as public authorities, and also helps build trust in the public in what we're doing with their personal data, but also that we are using data in general to make decisions that impact them in an informed and safe and ethical way.
I guess there's 3 words I always use, and that is document, document, document. I think that really is the key to how, from an assurance perspective and from a regulator perspective, we can always, be able to, step back and go, actually, we've considered this, we've done our due diligence, we put the right things in place. And if we're challenged then by a regulator or by an individual, at least we can, confidently be able to, set out where we've considered things. I mean, data sharing is a challenge. I mean, from a health perspective, we've got fantastic data sharing that goes on in Wales. We're very fortunate. I'm extremely fortunate that I've got a service that underpins and supports all of our public services and third sector in Wales, and we brought loads of organisations together, and it really does help. But a couple of colleagues this morning have mentioned that some of the key things that they could really do with our standard governance structures, and they are really important. I think standards really do help. If you look at it, why have we all got our own versions of data protection impact assessments? Why have we all got our own versions of, data controller agreements? We don't need multiple versions of things. We've all got to comply with the same requirements, and it's about bringing people together. So, I mean, Wales, we're very fortunate. We've got that kind of structure. We've got those standards, and we've brought the public services with us over the past 20 years. Ironically, I would say, and I think this is a fair comment as well, that the pandemic actually brought us closer together. It proved that if you had some standards and structures, you could do things. I think colleagues previously have said today that unfortunately sometimes when you're pressed with a situation, that really does bring the light while you do something, and sometimes privacy becomes the last thing on the mind, and it's, we'll deal with that afterwards. And I think that's true to a point. But what I do also think it's really demonstrated, the pandemic did, the opportunities that are there if we can do things in the right way, and if we engage and collaborate in the right way as well. So hopefully when I get to my lightning talk in a little bit, I can share with you a little bit of what we've done in Wales. But I do think that standards really do help, and I think that the pandemic did bring a lot of us closer together, to be fair.
Yeah, I'd absolutely echo that. We were heavily involved in an advisory capacity, but just to make sure that everything that was happening with data in Wales was in accordance with the Data Protection Act, because we all wanted to try and get to, the pace that we were moving at was ridiculous, turning over legal documents overnight sometimes, just to make sure it was there in place. And it can be done when there's a need, and there's a public need for it. Just on Dave's point there's a lot of templates out there already. There's no point in reinventing the wheel if somebody's done something. Certainly on the ICO website, shameless plug here, by the way. On the ICO website, it's all free. There's loads and loads of guidance. There's data protection impact templates. There's everything you need to know about sharing agreements. We've got our own UK code of practice, data sharing code of practice, which is ably supported by WASPI, the WASPI framework, which we've been part of for some time. There's a lot out there. And we've talked a lot about AI as well today. I think that's been one of the key takeaways for me, how important that is. As arguably the regulator in the AI space in the UK, we've already got some guidance out there on what you're doing with the algorithms, how you can be as transparent as you can be with those. And also, again, shameless plug, on the 14th of October, we've got an AI basics session at our Data Protection Practitioners Conference, which is an online event. So feel free to go to our website or see me later, and I'll show you how to register for that. You only got to attend the one session if you want to, so because it's all online. So shameless plugs done. Thank you.
I don't have many shameless plugs, unfortunately. We rely really heavily on the guidance provided by the ICO and by what was the Responsible Technology Adoption Unit, part of the Department for Science, Information and Technology at UK Government, is now Government Digital Services. They have a data ethics section. They provide a lot of guidance. It's currently under review, but it is helpful. I just kind of go back to the point around stuff. I'm not going to pretend it was easy, it wasn't, but we were able to embed privacy, data protection, data ethics less so because it wasn't so much a thing we were thinking about, but data protection was embedded from the start. You know, the first thing I did was start a DPIA. You know, and that, it does involve all my team, but it's not the barrier that people seem to think it is. It can be embedded from the beginning. Privacy by design is the phrase that you use. We had WASPI engaged really early on, and it actually helped us make really good decisions about the data that we were able to use, who we were able to share it with. That was perhaps more informed and perhaps a little bit more risky than some of the decisions that were taken in England. So we were taking health data, sharing that with our local authorities because they're at the front line of delivering services to the most vulnerable people. But we also were able to take an informed decision with the help of the ICO that we could share that data with the supermarkets, because those people needed food and they needed priority access to delivery slots that were like gold dust in those first few weeks. So we were able to take that decision that we could share a limited amount of data with a private sector, several private sector organisations. UK, England level didn't feel able to do that. So embedding it early isn't a barrier. I think the point I'm trying to make is it's an enabler. It helps you make good decisions.
And there were differences in the two sharing mechanisms there, which is what, you know, it's those subtle differences that can make all the difference, funnily enough. And I think we were working there, we actually had a joint arrangement with 33 different organisations, all under one data protection umbrella at the time, which was unheard of. But the pandemic did throw up some interesting things that we had to deal with. So to get that over the line was tremendous. And we had the 4 nations of the UK all having slightly different approaches to how they responded to COVID as well. So which was, again, something that was not known to us at that time, really, was it?
No, and we were able to take the lessons that we learned from COVID into our Ukraine war response. And I think England was too, but I'm less familiar with how they went about it. But we took a number of the products that we developed, data sharing agreements, a data protection impact assessment that's focused around the data share. So it asks very specific questions about who you're sharing with, why, how are you moving the data, and all of that, into our Nation of Sanctuary response with Dave's assistance on an ISP, which was the 33 signatories, which was done within 3 months, something like that, from beginning to end. Yeah. So it's not a barrier. Yes, it needs some resource, it needs a little bit of time, but it shouldn't slow you down, which is the thing I hear a lot. I suspect Dave hears a lot, is that this takes too much time. It doesn't. You can do it if you want to.
Yeah, and I guess the last thing for me is, whilst things are much, much better now than they were 20 years ago, and they really are, data sharing challenges are still out there. We still see those headlines, those missed opportunities from a UK perspective on a regular basis, the missed opportunities of data not being shared between agencies with particular partners, resulting in harm or even in some cases worst case scenarios in relation to children and vulnerable people. And it's really important that whilst we focus on all the good things that we can do across health, is that we remember that we do also have our other public service partners who are equally important, because we're data rich actually in health. For someone that's come from local government for 20 years into health, it's been really eye-opening for me, and the opportunities we've got for the data that we have to actually open up and share collectively. I promised Anna I wouldn't mention too much about the Digital Economy Act, but it's got real legs and opportunities for us in Wales to really expand upon things even further, to allow us to share even more. Don't know whether that's what the ICO want me to say either, but I think it's absolutely the right thing to be promoting. But yeah, there's a lot more to do. We're in a very, very good place, I think. I will do a shameless plug, because Dave and his colleagues have invited me to the Data Protection Practitioner Conference this year, and we are going to be talking around data sharing challenges and opportunities. So if anybody wants to find out a bit more about it, feel free to also jump onto the panel I'm sat on, as well as Dave's as well, next month. Any questions, I guess, for us?
I'm not sure how much time we've got left, Paul, but happy to answer questions.
1 minute.
If anyone's got a really quick question, yep, go on over there.
So I really enjoyed the panel discussion, and obviously leading the National Data Resource in Wales, and having managed a lot of data sharing, I can vouch for the support that we get from colleagues to keep us safe when we do that, and have those processes in place. So I suppose my question was more around the ethics, because I think the law is pretty easier, right? It's black and white. You're either abiding by the law or you're not, and there's consequences when you're not. I suppose when it comes to ethics, some of that can be quite subjective, because someone might think it's ethical and someone might not think it's ethical. So I guess my quick question on that was really what does good look like in terms of ethics assessments, and actually what are the consequences if we consider something to be an unethical use? And then if you want to fit in another one really quickly, my other question was about how do we go about having the right conversation with the public? So we talk a lot about trust, and there is a conversation to be had, isn't there, about what does that mean, and what do we use your data for, and how do we protect it? And I suppose a view potentially from government really on how we take that forward. Thanks.
You're alluding to a data promise there, aren't you?
I don't think it's that anymore, is it? I'm not sure.
No,
I
don't think it is. I will be very brief, because I know we haven't got a lot of time. What does good look like is an evolving picture. Yeah, what ethical data use looked like 3 years ago now looks very different, with the increasing use of AI and algorithms and just machine learning, data science. It all looks very, very different. I think I'll go back to Dave's 3 words, which is document, document, document. Document your decisions. Look at the obligations under the Equality Act. Assess those impacts on different demographic groups, particularly those that are specifically named in the Equality Act, but it doesn't need to be limited to those, and it shouldn't be. And keep that alive is, for me, the thing that I can't tell you what the best practice is for a data ethics assessment. They change. UK government are currently reframing theirs, and that will look very different to the current one, which is helpful and it asks good questions, but it's to keep it alive, keep going back to it in the same way that you should be going back to a DPIA. Things change, things move, keep it alive, keep asking those questions. How do we frame those conversations for the public? That's a really difficult thing. Transparency is key. We know about our obligations to be transparent when it comes to personal data, but I think it's less clear about what our obligations are, and they're more moral obligations than legal ones when it comes to use of non-personal data. And I think that's something that, as Welsh Government, we're still kind of grappling with. I think UK Government are grappling with it too. If you have any ideas, please come talk to me.
this may be an unfair question because I'm not sure jurisdictionally now how it works anymore, but about 3 weeks ago the European Court of Justice has changed the long-standing view on pseudonymization for data transfer, and I'm just wondering, does that affect the Welsh thinking at all, or have you had time to digest the finding?
Oh, you've got one. Oh, I'll get one. The email hit my inbox last week, and I don't think we've really given it a great deal of thought as to what this actually means for us yet. There's a lot of thinking ongoing around the DUA Act, Data Use and Access Act now, what that means, and I suspect it's all kind of caught up in that thinking, but it's something we're aware of. What it actually means in practice for us, I don't know. Dave, do you have a view?
No, it's something we're obviously taking into account, and we'll be reviewing our own guidance as out there on anonymisation and pseudonymization. Just for me personally, there's always been a fine line between the two anyway, because arguably if you engineer a process to take it, to depersonalize it, you can reverse engineer it. It's a question of where the mechanisms are for re-engineering it that says how unlikely or likely it is. We have got mechanisms in Wales that are working around that. They will be being reviewed in accordance with that. It's a little bit too soon. We're still reviewing all our guidance with the new Data Usage Act that's gone through as well. So, but watch that space, I would imagine.
The next session. Thank you so much, Fireside Chat, for this conversation. I see that this trio is used to work together, so we benefited from these excellent presentations. So I now call here to the floor, and on Zoom, I think we have already Guru Kora from the US. Unfortunately, Guru could not join us here on presence as you planned. That's the advantage of an hybrid event. We have Guru online, and I would like to call here to the floor the speakers from this slot now. Andrew Rotham, Dr. Andrew Rotham, the chair of SNOMED International. It's a pleasure to have you here, Andrew, on site these days. We have to thank a lot all on-site participations. Thank you so much, Andrew, for coming. And so we are also going to have Dave Parsons. You shouldn't be departing, but anyway, Dave, thanks so much for doing yours. You being the first to present. We have Guru Kora online, and who else we have in this slot? I think that's all. That's the three of you. Anyone else for this panel? I think we get some last minute. Let me double check. Yes, it's David Chiarugi. Sorry about this. He couldn't also join online, on site, because he had some health problem. But I think he's online also. David and Guru, can you show yourselves on the Zoom, please? Oh, Guru is online now. Guru, good morning to you.
Yeah, good afternoon, everybody.
Good to have you here on the Zoom, and we still need David. I'm not sure, David, if you are online, turn your camera. He had some health issues, and fortunately, I'm not sure if that is the case for him to be online with us. Oh, we have Dr. Padma here, our Zoom host. Okay, so I think without further ado, we should start, and apologize for the David health condition. Is unfortunately not able to join. Maybe he will be able to join tomorrow because he also has a presentation, an intervention tomorrow. But we are all ready to go. So Dave, your presentation now, and then we'll do lightning talks, and then we start the World Cafe, the first World Cafe in the day.
Right, here's the challenge. I got 8 minutes. I don't really often talk in 8 minutes. It's usually double that. So I've mentioned a bit about data sharing. I can explain to you a little bit about what we've managed to do in Wales that's been extremely successful in the past 20 years. Within Wales, we've set up what's called the Wales Accord on the sharing of personal information. So 20 years ago, we all found ourselves experiencing the types of problems that we still come across now in some respects. where there were multiple different versions of data sharing agreements being circulated between partner organisations, and that was a real challenge, particularly for governance, lawyers, for anybody working across public services in particular. So back in 2005, there was a programme that was commissioned within the Welsh Assembly at the time that was called Data Share. And that was focused then at that point around looking at how we could create a standard. Could we create a standard that we could encourage other public sector bodies to sign up to in terms of a template? And that was pretty much where WASPI was born. What we've managed to do since is to be able to set up that standard, but also to really embed it within public services in Wales. Sorry, this flicker is either slow or it's me. There we go. And we did it through what was called the Wales Accord. So the Accord is a document, it's a best practice document, but it's a commitment from an organisation that they would work to the standards that we have set up. So across Wales, at the time, we'd set an information sharing agreement, so what was called an ISP. And there was a commitment that if an organisation in Wales was going to document reciprocal two-way data sharing between any partner organisations, it could be one organisation, it could be several hundred, does happen, that they would commit that they would use that national template. So we almost had, if you like, a once for Wales approach to documenting data sharing activity that was going on. And that's proved to be hugely successful, I will say. There's been a long timeline associated with WASPI. As I've said, it's 20 years in November, and I've been part of it since the start. It's been an awful long time, and I've seen how it's grown. I've seen how it's become embedded within our public services, but also now within the third sector too. We've taken this on to really embed it across all of Wales with all our organisations. We've had lots of change throughout the time. So we mentioned earlier that legislation, the law, changes quite often. Obviously, a big change came in 2018 with the introduction of GDPR. That was, the single biggest change to data protection laws since 1998. And prior to that, of course, it's worth remembering that the law was only really reflective of paper records, not electronic records. So, that was a revolutionised change for us that we had to go through. But we've gone through many iterations since, and more importantly, what we managed to then do was to set up regional boards. So we've got 5 regional groups across Wales that report into the WASPI Management Board that we've created that consists of a number of key personnel, the chairs of all the regional groups, but also has representation have proved they proved absolutely pivotal in being able to take WASPI forward. That allows for an information sharing agreement to be created between partners to then be considered at that regional group by a number of industry experts covering public services and third sector. So it allows for that challenge, if you like, that due diligence to be undertaken before something is then signed off. And then signed by all the signatories. So we mentioned a couple of examples earlier. The nation of sanctuary work that we've done with Welsh Government that had 22 local authorities and all the health boards and trusts as well. We wouldn't have been able to achieve something like that 10 years ago, 20 years ago. That's how revolutionised WASPI has become. It's embedded into what we do. If anybody mentions data sharing now, they know in Wales WASPI is the thing to go to. The pandemic, I don't need to sell the importance of WASPI around that. There were Institute of Government reports that have openly recognised how vital and important WASPI was, and why Wales was probably the only UK nation that was able to successfully not only put in place the right support mechanisms, but was able to document and provide assurance to regulators around data sharing activities. Not across everything, myself and Anna often have conversations about what some decisions that we did have to make that were reasonable at the time. but we were able to have that confidence that everything was documented, whether that was through to sharing of information in relation to the track, trace, protect system, all the way through to sharing information around vulnerable adults, unpaid carers, you know, all these things that we were able to do was as a result of being able to give confidence to organisations that we could document what we were doing. WASPI is really good, right? It's fantastic. It's a best practice framework, but we are trying to take it to the next level. I can't say too much around it at the minute, but we are working very, very closely with our Information Commissioner colleagues, because there is a section of the law that actually allows us to create a formal code of conduct, and that would be signed off by the UK regulator, by the Information Commissioner's office, that would then regulate and give us the stamp of approval on something to be a formal code. We are very close, hopefully, to being able to submit that formally into the consideration process, and that in itself will take us and elevate us to the next level, because what we want to do is take our best practice framework and actually make it mandatory. On one of my earlier slides, I think I showed we've got over 850 organisations now across Wales signed up to the standards. That figure is growing by the day, mainly because at the minute we're targeting all of our schools where a lot of hugely important and sensitive information is shared on a regular basis, particularly from a safeguarding perspective. So we are looking to take what we've got and make it even better, and that's the ambition over the next 12 months, and then for the next 10 years to really embed that into what we do. And I guess my message would be this: if we can do it in Wales, you can do it anywhere.
Thank you so much. This is something that we're going to take. If we can do, but then in Wales, we're going to do, it can be done elsewhere. Good. So, Steve, I hope that by now the question you posed last day, why Wales, is starting to get answers, right, here. Unfortunately, David, I'm not able to see David online. I'm not sure if he's going to join or not. So, Andrew, I think I'll pass the floor to you. Thank you for being here, and let's hear from you.
Okay, thank you. So, I'm going to talk about SNOMED CT and real-world data innovation. So there's a bit of a background about me and my many roles and hats that I wear across sort of organisations at the moment. I've spent probably the past 20 or 30 years doing data-related things on health, from epidemiology back in the early 90s on HIV and outbreaks and how we first started to treat it as a gross pandemic at the point in time when we were first intervening, through to working on some of the world's largest programs of population health. So I was the chief exec of the Programme for Our Future Health to set it up in its infancy and get it to the point where it is now. I've also worked on the Million Women study, which is still probably one of the largest and longest followed up studies in history of women around their age of menopause. We recruited 25% of the UK women at that time point and have now followed them for the best part of 30 years to follow history and into ageing. And so my interest in all of this has always been how we use data which is routinely collected to better serve the health of people, and to think about how that works in an optimal way. So I now chair the board of SNOMED and have been on the board now for the past 5 years, since the beginning of the pandemic. And SNOMED as a terminology is kind of one of the enabling features of that. As we think about what's the importance about how do you share and use health data effectively, it's about having reliability and underpinning quality in the data that you're actually using. And so I'll go back to some of the journey that we've been on as a group of individuals who use data, and particularly drawing on the fact of what I'm about to say and how it draws from history. But if you look back over the years I've worked in big pharma companies and I ran the data assets for GSK for many years and running all of our post-marketing work, we would have about 100 million persons worth of data that we could draw on to actually look at the safety and efficacy of products. And we would do that across the world, we would follow them, we would track them, we would look at those things. The challenge of using that 100 million things is they came from about 20 or 30 different sources, from claims in the US to EHRs to GPs in the UK and in France and in Europe. Everybody had their own little coding system that they wanted to give us. So trying to do inference on 100 million patients meant that you had to do it about 10 different times with 10 different definitions, with 10 different ways of thinking about it, to get to one answer, which we could then go to the FDA or the EMA or the MHRA, whoever we needed to talk to about the safety profile. The core of then thinking about where common data models have come in, and everybody's been obsessed with common data models now for the past 15 to 20 years, whether it's OMOP or Sentinel back in the agency days of thinking about drug safety or some of the stuff that's going on in Europe and has done for the past few years now, is if you can think about a common data model, you take the almost lowest common denominator of the coding set that you have and get your data to look like that. That means that you can then do one analysis across everything, you use the same codes, the same definitions, the same analyses. And I think where we're going today is now taking that to the next level, about thinking particularly about when you think about AI in healthcare and thinking about how you maximize the value of data, is to think about what's the underpinning language and terminology that you build into your core part of your system in the simplest possible way, so that doctors, or nurses or healthcare practitioners, when they code data, they code it once and it's used many, many times. You don't think about multiple types of coding, as often happens today, where the clinical system is a little bit different from the reporting system, is a little bit different from the code system that ultimately ends up reporting up to WHO. So SNOMED-CT is the tagline of global language for healthcare, and the theme of what I'll keep repeatedly saying is it takes away some of the fragmentation in interoperability. It is not the singular solution for interoperability, and no one single coding terminology will be. If you work in healthcare and work in the joyous world of standards, you will realize there are many, many standards that you will have to use. You cannot just use one. There are concepts of standards in nursing, in dental care, in laboratory and recording, in genomics and ontologies for looking at what the sort of individual phenotypes are there. SNOMED has made a conscious effort over the past few years to think about how all of those can start to join together, but to join together in an integrated way, not in a singular, there will only ever be one, but to say that for different purposes and different use cases, there will be different needs and different standards coming together. But if you think about AI and the AI sector, what do AI companies actually need? Well, they need to be able to train some model. And if you're going to train some model, you need some data to train it on. And so if you look at why AI is struggling quite a lot in healthcare, particularly in biology, it's because there is very little publicly available data upon which you can train on your corpus. So if you ask AI to go and write you a novel, it's pretty good because it's got access to pretty much every novel that's ever been written. It's built a model around it. It understands word prediction orders. It understands the structural things. If you tell it to go and read me an X-ray report, there aren't that many X-ray reports out there that it's trained itself on unless you've got a very, very big data set that you've given it of images. If you give it the option of reading an MRI set, that becomes even harder because they're quite big to read and they're really, really big files. So there's a lot of gaps in how we build AI models because the data sets are very sparse. On enriched and growing healthcare data sets. So the quality of doing that means that you need to do it on the same way with the same data in the same structure with the same terminologies with the same codes. And that's kind of core and central to everything that we think about in healthcare. That will give you the quality assurance of knowing that the model that you have trained actually has applicability in multiple domains and multiple jurisdictions. The challenges of all of these models in AI and all of the apps and things is you can flick a switch overnight, you can completely change your little app that you just built. It'll look very different tomorrow morning. How do you know that the change that you made overnight to your coding algorithm actually will give you reliability in the future? So what I believe that the sort of core of infrastructures here is that when we talk about sort of fragmentation and uncovering some of that fragmented data, it's bringing it together into these models. It's about thinking about what the tooling needs to be and how we enable that training. And building SNOMED or all of the terminologies in at the core of the system ultimately lets you start to think about this in a very, very different way. It ensures consistency, it ensures the sort of cause of interoperability. and ultimately starts to reduce the risk by which AI can really sort of build upon the data that we look at. And certainly when we've looked at various sort of pilot activities of how you can train some of these AI models, particularly for things like translations, if you're translating between multiple languages, healthcare words are really hard to translate because they don't appear, again, very often in many different languages, so the models don't have direct translatability. When you're thinking about terminologies, doctors don't need to remember lots of codes. In fact, they shouldn't, because it'll kill them if they remember all of these codes. You need systems which ultimately allow the codes to be captured as entities as people are typing or speaking into the systems. So the growth of agentic sort of agents that are used as note takers within the systems require the ability to take what I say, which things like ChatGPT can do and can write me an email in seconds, but to include within it lots of really complicated descriptions which then get translated into entities. That is an incredibly hard problem to solve, and many, many companies, Microsoft, Google's and the others around the world are intentionally trying to solve it. But it is a non-trivial problem, and there is not a singular good solution to get there today because of the complexities of some of the languages that we use. Ultimately, if you've got that sort of growth in the sort of standardized data coding, you've got that reliability that I trust that the hospital here in Cardiff matches what I have near where I live at home in Slough and matches the one that I have to go to in London as a specialist centre. The ability to then move data between those centres becomes really, really easy. And that validity improves the sort of interoperability, it enhances the quality and enhances the sort of ability of AI to actually use that data in a really powerful way. And ultimately, if you use that data in a really powerful way, that's where you get back to some of these goals that we want to really tackle. The really important things is how do you improve the care of people? How do you learn from people about what it is that's working and not working in healthcare to make ultimate sort of changes to the sort of global and national and international goals of healthcare? The costs, again, goes back to the more data you need to go and mine and train, the more you need to find, the harder it is. So the more powerful it is to use these sort of terminologies which are standardized across the globe. I'm really thinking about how does this lead to the future? How do you get to a world where we can actually interchange data? It is not many moons ago, for those who've never had to deal with US data transfers, where fax machines were and still are in some centres quite common to interchange patient health records between them because of the complexities of EHR integrations and interoperabilities of coding that's used, whether it's ICD-9 as was then and only just ICD-10 in the US. But how you sort of move things around becomes really hard. FHIR and HL7 have really helped the messaging, but the messaging only works if you're using the same semantic context in what the data means underpinning all of that. So enabling that access to global expertise, to tools and to ability to use this really will transform the world to create this new sort of lake of data which will be much more powerful than what we've had today, will require much less effort to actually start to make it usable because it'll already be in a format that different places in the world, different types of data set bring together. And that, I think, will be the thing that transforms how AI starts to operate in this wider world of healthcare, supporting and really building on some of the great things that AI can do. But AI can only be really, really fantastic if it's being built on the sort of core data that's actually understandable, interpretable, and is driving towards that overarching vision of improving the health of the nation. With that, thank you very much.
Thank you, Andrew. And I think, Guru, if you are online. If you're online, please go ahead and introduce yourself, if you'd be so kind. We are all yours now.
Yes, good afternoon, everybody. Nice meeting you, everyone. Today, I want to start with a story of Olivia Bernstein. She's a 34-year-old woman, works full-time, has 2 kids. And one night at 2 a.m., she wakes up with a massive toothache. And she also realizes she has fever. Now, at that hour, she has 3 options. Olivia can call her dentist. but it's 2 a.m. in the night, dentist will not be available to address her issues. Or else she can go to an ER, but ERs usually don't have dentists on staff. And she can wait till morning, which feels impossible. This is not just Olivia's story. Millions of people face moments like this every day. Scared, in pain, and unsure where to turn. Olivia's story is not about toothache. It's really about the bigger issue of having access to care. Globally, there are 3.7 billion people lack reliable access to healthcare. Even here in US, the fragmentation to access is huge. Specialists are not available 24/7, and ER visits are often very expensive and doesn't address all the problems like Olivia's here. And affordability is a worst thing. A single ER visit here in US can cost hundreds and if not thousands of dollars. So Olivia faces two impossible choices: suffer through the night or pay a fortune for a care that won't even solve her problem. That is the equity gap in healthcare we are seeing today. But imagine if Olivia had another option right in her hand. She picks up her phone, opens an app, and consults an AI-powered health assistant. It listens to her. It makes the connection from fever to toothache. It offers safe, non-invasive recommendation on fever management, and perhaps a saltwater rinse or something like that, and advice on what to watch out for overnight. More importantly, it assures her that it's safe to wait until morning, and even help her schedule a virtual visit, consultation with when the clinic opens. All of this happens privately, securely, and in an instant, because the AI is running directly on the phone. She's talking to the AI directly on the phone. Her conversations don't leave her phone. Suddenly, Olivia doesn't suffer anymore. She doesn't have to go bankrupt going to an ER, and she has peace of mind because she has access. Now let's scale this story. For every Olivia with a toothache out there, there is a mom with a kid whose fever is spiking. And there is a patient who has diabetes in a rural town somewhere, miles away from the nearest clinic. And there is an older adult running out of medication. They don't know what to do. AI-driven digital tools expand that reach of healthcare. They provide you that accessibility. Anytime, anywhere, even offline, some devices where AI runs offline completely on your device, completely private, secure, and affordable, low cost, and even free sometimes. And it can be completely personal, tailored to your clinical history. Advices based on your chronic conditions, may it be asthma or hypertension or diabetes, and private. Conversations stay on the device, building trust in the community. But mind you, this is not about replacing doctors. It's about filling the gap when the doctors are not available. So let's come back to Olivia. At 2 a.m., when she had no options, AI gave her something priceless. Reassurance that she can wait, she can afford to wait. It's safe for her to wait till morning. That's very important. And guidance with safe, non-invasive remedies for pain and fever. And care until she could see a professional next day. Now, imagine millions of Olivias. People around the world who are caught in these vulnerable late night movements. AI-driven digital tools can be their lifeline. And I have come from a place where rural India, with digital tools, you can turn that fear into complete confidence. You can replace that inequity into access. You can deliver care available when it is needed, where it is needed. Technology is not important at all. How you provide that technology is really important. That is the promise of AI for healthcare, for health equity. Ensuring that no one anywhere is left without a simple care because of the hour of the night that they have problem, the remote area location that they are in, or whether they can pay for that or not. And this is exactly why we are building Times AI Health. To empower people like Olivia with secure, affordable, AI-based digital health assistance. To make sure every person, no matter what their circumstances are, has access to care when they need it. Olivia's story is just one, but it reminds us why we are here. To build a future where healthcare is universal, accessible, equitable, and with Times AI Health, we can help get there. So please, if you get a chance, go to Apple Store and check it out. It's completely secure, and you can get AI-based guidance on your phone. Your conversations stay there. So thank you so much, everyone.
Thank you so much, Guru, for this presentation. It was interesting to see your style of presentation is like a narrative and lots of silence in the room, everybody listening, very effective. So now I think David is not able to join us online, so we have extra time here for a quick round of questions to our speakers before we go. Invite you all to start conversations in the tables, as this is going to be our first table World Cafe, where participants will have the chance to talk to our guest speakers here, and online Guru will have his participants in this breakout room, as Padma is already going to host that. Any quick questions for the presentation so far? Steve.
Question about SNOMED. What is, in your view, what's the real value add of SNOMED over ICD-11? What does it offer that ICD-11 doesn't give?
That's a very good question. So there is an ongoing piece of work, and in fact I was on the phone to the ADG at WHO the other day around how the two terminologies will continue to coexist. So SNOMED's heritage comes from the clinical world and coding for clinical purposes. ICD's heritage comes from the WHO world, which is counting sick and dead people. And so the two have always been driven by very, very different purposes. And there's a substantive overlap between the two systems, but it is not, it's 60, 70% overlap. And then you've got a whole bunch of weird and wonderful wacky codes, including being hit by asteroids and eaten by crocodiles and a whole bunch of other things that sit in there which can amuse you forevermore as you kind of dissect them. I think what both we and the WHO believe is that the two systems need to operate and be in coexistence in the simplest and easiest possible way, so that the end users of those systems can benefit from coding medical data in the right possible way. And if it needs to go to WHO and to ICD and they've been using SNOMED, that should be a seamless process just to happen. Now, there are lots of technical issues about how you actually enable those two things to happen. SNOMED is a true hierarchical terminology. ICD 11 sort of is, but isn't in its foundational sort of way forward. There's a bit of work that we're doing at the moment to think about how does that happen in the future so that you don't need to have two things continually. And it goes back to what I said, my belief, and I think the belief of many countries who actually have to deal with this at the reference centres, is you should be coding something once. And then it shouldn't really matter whether you're reporting in ICD or in OMOP or in whatever standard you want to put it into, it should be able to get there. And it's the sort of standards body's jobs to kind of unpick some of the political complexities of making that happen.
Okay, more questions. We still have time for a few questions for panelists before we break the groups. Padma, online, any questions? More questions here?
So actually, I use SNOMED CT sort of every day in my data analytics. Very straightforward question. So firstly,
that was a very straightforward question. It was just a complex answer.
No. Well, so actually, to comment. So in terms of the difference between ICD-10 and or 11 and SNOMED CT, for me, like the level of granularity that SNOMED CT provides basically makes it workable from a sort of for clinical users. It actually also allows you to actually incorporate it in terms of clinical decisions being made and coded as people are working through it, right? So that's been the main benefit that we see. So the main thing that actually I still struggle with is the sort of idea of SNOMED CT sets and how that can be leveraged for AI purposes. And I was wondering if you could comment on that and if you're aware of any work that's being done in that area.
So I think how we see SNOMED CT benefiting AI overall, and not just at the sort of subset level or sets level, is if you can remove the barrier to entry for an AI company by providing it the knowledge of what the hierarchy and the terminology and the interactivity is, that's a massive barrier drop for them for the learning exercise to be able to train their algorithms. Because essentially what they're having to do at the moment is to take real world data that they can find, the algorithm trains the real world data, it looks for patterns, interlinkages, etc. Whereas there's a number of papers in the medical informatics literature coming out at the moment saying, no matter whatever AI does, if you can give it the foundational part of knowing what the interrelationships and the hierarchies are, that will massively accelerate and improve its quality and learning ability to deliver that sort of quality improvement in a system in the future.
Okay, so one last question, yes, and then we start with the World Cafe.
Guru, I'm a physician in Wales. I also I'll be opening tomorrow morning, but just want to come at from a patient perspective. Your story was very enlightening and provided great context and brought the patient into the room. And this question of providing access to care globally, particularly where care isn't accessible very well, is clearly a very important one. However, in sort of providing access to care is not the only goal. Providing access to quality care is actually the goal. So providing access to poor quality care is actually potentially worse than providing access. In your example, you mentioned fever, and as a physician, if you see someone with fever, you have to question how close are they to sepsis. So my question would be on the AI app algorithm, how would you test and how would you verify that the information you're providing to that patient actually was the correct information, and that reassurance that you mentioned was actually appropriate? And how would you actually measure the patients who needed to go to the ER, but maybe the algorithm got it wrong?
Yeah, good question. Actually, there are a bunch of metrics that are available that's designed originally by Google. They have parameterized, because AI in itself is probabilistic in nature. It's not going to give you a complete accurate set so that you can reproduce that answer. So the goal of creating that metrics, there are a bunch of subdomains that they created those guidelines for, some parameters for, to all these AI companies who are creating some sort of a differential diagnosis algorithm as part of their AI delivery, care delivery. They created those guidelines, and most of those guidelines include, general clinical guidelines, what type of guidelines you give for what type of symptoms, and whether these guidelines actually align with, US standard of care or some standard of care that have been laid out, and whether they are verifiable, whether you can actually take a bunch of RWD data, real world evidence data somewhere, and actually give with the same type of symptoms and things like that, and the comorbidities together, and then whether you are able to recreate that, and what in amount of hallucination does an AI does, because in healthcare we don't want hallucination at all. So those guidelines are available. It's called MedPub, and MedPalm creates those fantastic outlines. But for now, whoever is writing either open evidence or Doximity or us, Times Health, whoever is creating large language models that have an embedded differential diagnosis component inside those LLMs to evaluate the symptoms and give safe, non-invasive solutions, are bound by, and they are measured with those parameters that MedPalm outlined. So we use that. Some of them are at 80% accuracy, some of them are 92% accuracy, and we are at 89% accuracy. So the goal of our technology stack is to increase that envelope all the time. We started out with only 61% accuracy 6 months ago. So we are moving fast, approaching things like, here in US, MCATs and things like that can be easily overcome by some of our AIs, just based on how we train, how we help it analyze the symptoms, and how we can map those symptoms for evaluated RWD data, which is real world evidence data that we get from the EMR dumps and things like that. So there are metrics available. Thank you for the question.
And now we're going to wrap up for the final 15 minutes in the World Cafe before we break. I would kindly ask our guest speakers here if they take a table to host, as if they will be leading the conversation forward in the shared document we're starting. Dave, Andrew, can pick a table, except that one where I have already a table host there. Iñaki is going to host the table. So what we expect from you now is talking with each other, guided by the table hosts. Dave, Andrew, we need you. No, it's not just speaking, it's just also listening. So now you're going to listen to the group, and we have now, maybe I would invite David, and because we have maybe to concentrate some groups, David and the lady, if you could please join this table here, not mine. And in that case, Andrew, maybe you could sit over here. We still need a host in this table here. Dave, you are there. Dave, it's a little bit unfair because I think David could be hosting that conversation, right? So Dave, if you could join this table here. Okay, and can I ask you four to come to this table here and having a conversation here together? So let's... Let's start. Let's start. And the conversation is, what are your recommendations?
Hope you are able to hear me.
You're starting the breakouts in your Zoom?
Yeah, I will be starting the breakout right now.
Okay, the theme is, what are your recommendations for the joint charter on secondary use of health data? So we have to have a common document on secondary use of health data. Okay. Let's start.
I'm creating the breakout. Let us, all online participants, let us get into the breakout room now.
Okay.
Okay.
Sounds good.
We're having 15.
Second.
So we have 15 minutes now. I'm counting time.
You can join any room, whichever.
Half-time warning, 7 minutes, 7 more minutes. Join us here as we had breakouts online too. So this was an hybrid setup. Thank you everybody. I think as this group concludes, perhaps starting from that group, quick conclusions from your discussions, David.
Okay, we've got 2 recommendations for you, Paul. So I will get on 3.
Okay, thank you.
Thank you. We were talking about the first session around compassionate leadership, and we felt that this was really, really useful, and we thought that the Charter could recommend it's considered at all. It's considered to be investigated more and encouraged within the work streams. And then we got onto AI, because we always do. And we were talking about equipping staff to use it properly, and also helping staff understand how it works, but by doing that, by displaying compassionate leadership and listening to staff. And that was what we said.
Thank you so much. Next group. Thank you all.
Here we were discussing about the role of patients and citizens in sharing data, and specifically the importance of do what you are supposed to do and plan what you are supposed to plan. So, and I think it is tremendously relevant. We were sharing also the different cases that we were having in different regions in Europe at least, and which was the purpose for secondary use of data. And one was discussed here was prevention, and the importance in the case of prevention that probably most of the data that we are using they are useless for prevention, because we are talking about the healthcare system, but the healthcare system is based on pathology and not on health. So probably our perspective should move, and probably the exchange that we need to have with the citizens in terms of that. Also, the metrics that we are using right now, they are useless in terms of planning for prevention instead of planning for healthcare. And also there was also a discussion about the, and correct me if I'm wrong, about the I would say the role that especially citizens should play in all those aspects that are probably we are doing all those things without counting with.
And how can all of that really enhance the sort of, and minimize some of the challenges I think lots of the national projects have often had in the past few years around being able to try to bring some of this data together?
Okay, thank you.
Lots of conversation on this table, mainly in relation to ethics. It's a shame I didn't have my Welsh Government colleague with me. But I think the general feeling from our table was one of the need for there to be some real clarity around where ethics and responsibilities for ethics is owned within organisations. Because both from a data controller and from a data processor perspective, which was mentioned, there's some risk involved here that we need to really consider. So the scenario we played out is that if you've got a data processor that's got a contract and they're being asked by an individual within an organisation to do something, where's their due diligence coming from and their assurance that actually the organisation who's the controller actually understands what they're asking ethically of the processor to do? So I think there's definitely something around ethics. The other thing we did pick up, which I think I picked up for many years, and that is the fact that we probably need a museum of technology to be retained for us forever to ensure that we can constantly access records and documents that are on various different forms, platforms and formats. It's an everlasting problem. It's one I used to have in paper records with microfiche years ago. But it is a really fair comment. One final comment, which was more frustration, is that we're talking about AI, but we can't actually get our data in some cases being shared outside of Wales into England and vice versa in a correct manner. So that would be quite nice if we could put that right as well.
Thank you so much. Don't forget to put that thoughts on the document later on. Not right now, that's not necessary. But please, let's have some time, tea time, coffee time, and we need to be back here. We need to be back here in 15 minutes. 15.